Hi guys, in today's video we are going to talk about the anatomy of the thorax. The thorax is also known as the chest and it forms the superior portion of the trunk. It is positioned between the neck and the abdomen. This crucial anatomical region houses vital structures such as the heart, lungs, and neurovasculature, which supports respiration, circulation, and overall homeostasis. In this video, we explore the components, functions, and the anatomy of the thorax in detail. So let's start with the key components of the thorax. The thorax can be divided into the following components: the thoracic wall, the thoracic cavity, the neurovasculature, the organs, and the breast. Each of these elements plays a significant role in supporting the physiological function of the thorax. So let's start with the first one, which is the thoracic wall. The thoracic wall forms the protective framework of the chest, and it consists of bones, joints, and muscles, and also neurovasculature. It acts as a protective cage for internal organs while providing flexibility for breathing movements. So let's talk about the boundaries of the thoracic wall. The first boundary is the superior thoracic aperture. It opens towards the neck and it is bounded by the penumbrum of the sternum, the first pair of ribs, and the T1 vertebrae. Then the inferior thoracic aperture are largely closed by the diaphragm, separating the thorax from the abdomen. Now this is a vital point you have to understand. The diaphragm is what separates the thorax from the abdomen. So the next thing we have to talk about is the skeletal framework of the thoracic wall. The thoracic skeleton comprises of the sternum, 12 pairs of ribs, and 12 thoracic vertebrae. It also has interconnecting joints like the intervertebral discs, the costovertebral, the sternocostal, and the sternoclavicular joint. Now the intercostal spaces and muscles of the thoracic wall. In between adjacent ribs lies intercostal spaces which contains intercostal muscles, which are the external, internal, and the outermost, and it also contains the intercostal neurovascular bundle, which contains arteries, veins, and nerve. So additional muscles such as the transversus thoracis, the subcostals, the levator consterum, the serratus posterior, inferior, and superior supports the thorax and assists in respiration. Now let's talk about the thoracic cavity. The thoracic cavity is an enclosed space within the thoracic wall, containing vital organs and structures. It is divided into three compartments. Number one, the mediastinum. Located centrally, the mediastinum is divided into superior and inferior. The superior mediastinum contains structures like the thymus, the aortic arch, the trachea, the esophagus, and major blood vessels, while the inferior mediastinum comprises of the anterior compartment, middle compartment, and posterior compartment. In the anterior compartment, it houses parts of the thymus, adipose tissue, and lymph nodes, while the middle compartment contains the heart, the pericardium, pulmonary trunk, and trachea bifurcation. Then the posterior compartment includes the esophagus, the thoracic aorta, the azygous venous system, and the thoracic duct. Then the pleural cavity. So on the other side of the mediastinum lie the pleural cavities, each enclosing a lung and lining by two pleural layers, the visceral layer and the parietal layer. The visceral pleura covers the lungs, while the parietal pleura lines the thoracic wall. Now let's talk about the neurovasculature of the thorax. The thorax houses a complex network of arteries, veins, and nerves that supplies its structures. So let's start with the arterial supply. All thoracic arteries originate from the aorta, and key arteries include the bronchocephalic trunk, the left common carotid artery, and the left subclavian artery. Additionally, the bronchial, the posterior intercostal artery supply specific thoracic regions. Now the venous drainage. The major thoracic veins include the superior vena cava, the azygous venous system, and the pulmonary veins. They collect deoxygenated blood and return it to the heart. So for nerve innervation, the thoracic nerves forms the visceral plexus around the organs, such as the esophageal plexus, the cardiac plexus, and the thoracic aortic plexus. Now let's talk about the organs of the thorax. The thorax contains many vital organs, and each with their distinct function. Number one is the heart. The heart is located within the middle of the mediastinum. The heart functions as a muscular pump with 4 chambers. It has 2 atria and 2 ventricles. It facilitates pulmonary and systemic circulation, and this is regulated by the valves such as the tricep valve, the mitral valve, the aortic valve, and the pulmonary valve. The heart's automatic control system is governed by the sinoatrial node, the atrioventricular node, and the conducting system. Now, number 2 is the lungs. The lungs, housed in the pleural cavity, enable gas exchange through the respiratory passageways, the trachea, the bronchi, the bronchioles, and the alveoli. Each lung consists of lobes and segments separated by fissures. The lung receives oxygenated blood from the bronchial arteries and veins, and are innervated by the pleural plexus. Now, the trachea. The trachea is a tubular organ located anterior to the esophagus. It is supported by the cartilage rings. It is divided into bronchi, which transports air to the lungs. Then the esophagus. The esophagus is a muscular tube extending from the pharynx to the stomach, facilitating food transport. It is innervated by the esophageal plexus and it is drained by the azygous system. Then the thymus. The thymus is a lymphoid organ located in the superior mediastinum. The thymus plays a crucial role in immune development, facilitating T-cell maturing during childhood. Now, finally, let's talk about the female breast anatomy. The breast is a secondary sexual characteristic situated on the anterior thoracic wall. The primary function is milk production, supported by the mammary gland and the lactiferous duct. The breasts are anchored to the thoracic muscles via the suspensory ligaments and are supplied by thoracic arteries, such as the internal thoracic and the lateral thoracic arteries. The venous drainage occurs through the axillary and the internal thoracic veins, while innervation is provided by the intercostal nerves. So in summary, the thorax is a dynamic and a vital region of the body, housing critical organs, neurovasculature, and other structures essential for life. Understanding its anatomy is key for students and professionals in health sciences, offering insights into its protective, respiratory, and circulatory roles. So whether you are studying for the intricate anatomy of the heart or the lobes of the lungs or the skeletal framework of the thoracic wall, a deeper comprehension of the thorax enhances your appreciation of the human complexity. You can also find other videos to read more on the anatomy of the thorax and go in depth in learning. You can utilize other videos on YouTube. You can find other textbooks to read, and you can also quiz yourself to get more detailed knowledge on the anatomy of the thorax. Thanks for watching and good luck in whatever exam you are preparing for.